Malik. Today I want to talk about an important topic, that is heart attack. Today morning at 4 o'clock we got a patient with mild heart attack, and at 5 o'clock we got a serious heart attack patient. What is serious? What is mild? Let us discuss. What is serious heart attack? What is mild heart attack? Let us come. First of all, the heart is supplied by 3 blood vessels. This is heart. It is supplied by 3 blood vessels. This is aorta, which supplies blood to the whole heart. It comes, whole body it supplies. This arises from the heart. When the heart pumps, the whole blood goes into the aorta and supplies the whole body. Total body is supplied by fresh blood. Okay. So from this aorta there are 2 main blood vessels, right coronary artery, left coronary artery, and a circumflex artery. Actually 2 main and 1 is subsidiary. Okay, these 3 blood vessels, they supply the muscle of the heart. If there is some block somewhere in the right or left or in this, so if there are blocks, then only you will suffer heart attack. So what is heart attack called? Myocardial ischemia, myocardial infarction. Myocardial ischemia means the heart started having less blood supply, and myocardial infarction means the heart already suffered the problem and now the heart is getting damaged. That means already ischemia is there for some time, already blood supply is not there for some time. Now the heart muscle is getting damaged. That is called infarction. Myocardial ischemia, myocardial infarction. Ischemia means less blood supply. Infarction means already there is less blood supply. Now the heart is getting damaged. Okay, that is very, very important. These 2 patients in the morning, serious, and 1 little serious and more serious. That's the thing. So what are the tests we do? Immediately we'll do ECG first, and there is one blood test called troponin blood test, which if it is positive, immediately we should send the patient to cardiologist by giving some medicines initially. So what are the ECG changes? This is normal ECG is like this: P, Q, R, S, T. P, Q, R, S, T. See, in ischemia, in myocardial ischemia, which is mild, this will be P, Q, R, this is R, S, and this T wave, it is upright here, it will be downwards here. And again, in this P, Q, R, that S and T are downwards. You can see it is upper here. This is called ST depression. ST segment goes down. Okay, this is myocardial ischemia. And next one, a serious condition, which is called myocardial infarction. There won't be anything like this. P will be here. Q, R, S, everything goes up. This is called this is ST elevation. QRST elevation. ST elevation we'll call it. So P, QRS will be like this. So it is a serious condition. Immediately you should refer the patient to the cardiologist. They will stabilize the patient, and they will first do an echocardiogram and stabilize the patient. Echocardiogram, you all know, it is nothing but scanning of the heart. It is something like a scanning of the heart. And next they will do an angiogram. Angiogram is, you all know, they will put a cannula, a catheter into the vein in the cubital fossa or in the thigh. They go into the heart, they go into the blood vessels, and they see through a small camera any blocks here, this is called angiogram. And if there are any blocks in the same sitting, they can do stenting also. If one vessel is damaged, okay, they will put a stent. If second vessel is partially damaged, they can also put another stent. Usually, if more than 2 blood vessels are damaged, they go for bypass, because there are only 3 blood vessels in the heart, and if more than 2 blood vessels are involved, they will go for a coronary artery bypass grafting. That is CABG. So this is the thing. So how the patient comes is very, very important. In the book, it is usually written as, if anybody comes with and says, anybody after the age of 25-30, if anybody comes to us with a pain in the chest, which the patient had never had before, this is the first time having such a type of pain, immediately it should be taken seriously. And number two, if the patient, sometimes the patient may not have that much pain, slight pain here radiating to left hand, that also should be taken seriously. At least an ECG should be done. Sometimes ECG may not be immediately, there may not be changes immediately. You must do troponin test also, blood test. Troponin I or troponin T, there are two tests. And ECG should be repeated after half an hour or 1 hour if there are any changes coming. And some patients, they may not have pain. They may complain some burning sensation behind the chest or slight breathlessness. All these variants, sometimes they feel like gas that is burning. But this gas also, when you ask the patient, they say that no, this type of burning sensation I never had previously. I had something else but not like this. So some patients may not have pain, but they will have slight breathlessness, sweating, and you can see the agony in their face, uneasy, very uneasy. So the BP sometimes will be falling. All these things are very, very significant. So please don't neglect. This is an important, because this is a condition which can take away the life. Be very, very cautious. Go to the doctor. Any doubt, go to the doctor. And first get an ECG done. And sometimes we can miss in the ECG also sometimes. But stay with the doctor. They will ask you to stay for some time. After 1 or 2 hours, I get again an ECG and blood test also. Unless and until it is proved that it is not heart attack, please don't go away from the hospital. These are very, very important.